touch on the commercial launch and execution. You know, your go-to-market strategy leverages Indegene's AI, which I know we already talked about, but more or less what it does for you, and if you see that being used later on as you develop drugs throughout your pipeline. I mean,
it makes total sense.
Yeah.
I think the biggest thing that our partnership with Indegene does is it accelerates our over commercial infrastructure from being a small pharma company with nothing built to being right at the level of your big boys. So the Pfizers, Novartis, the Sanofis out in the world, they use Indegene, we're using Indegene. It basically puts us at a point where we don't have to go out and spend $150 million to build a field force, to build a medical liaison team, to build that digital infrastructure, to try to build an omni-channel, to try to build e-detailing. It's already built. So we get to bolt onto this tool and basically put ourselves right in step with all the other pharmaceutical companies.
Understood. So
huge advantage.
What exactly is your target market then? Is it just taking all the pediatric and adult patients with ADHD, or are you going to attack a very specific and particular market?
So if you look 5 years down the road, what we believe is this will be the first line product of choice. Now that said, at launch, you want to make sure you're setting your realistic expectations. 60% of this marketplace today uses a booster dose. That is 60% of a $22 billion market. That is basically the low-hanging fruit for Cingulate.
Now, is that just young people or is that everybody?
Across the board.
Okay.
And here's the other thing, 90% need it. So at the end of the day, it all comes down to entire active day efficacy. Our product is the first one that is designed with 3 releases of medication to provide entire active day efficacy, avoid the booster dose, have a fast onset. We've built this medication to basically be the next first-line agent, but our low-hanging fruit, that first segment we'll go after, is the patients on booster doses.
Now going back to Indegene for a minute, how is the arrangement designed so that the interests are aligned? So they're really fighting to go out there and get that next script.
So it's a very good point. Number one is Indegene, we are going to be their first full go-to-market launch. So they have a lot invested in terms of making sure this is very effective, that it works very well. Number two, we're paying them. Which is pretty simple, but at the same time, we have risk share opportunities built into our contract, which will allow Indegene to profit more off of a successful launch. At the end of the day, if we license this product out, Cingulate's going to see maybe 10 to 15% of the overall NPV. With our Indegene partnership, we're going to keep 95% of that NPV to Cingulate and its shareholders.
Okay.
But that provided, what is your timeline on break even and profitability then?
So based upon our P&L, with quite frankly very low market share captures, like our first year we predict about a 0.5% market share. Year two, 1.5, 3, 4.5, and 6. Now let's take that into perspective. Vyvanse currently has a 27% market share. We believe, and we believe the data has shown, we are more effective in the morning, the afternoon, the late afternoon, and the early evening. We believe we have better tolerability. So the market will play itself out. None of these other products are being promoted right now. We believe this product's going to be very successful. To answer your question, early part of 2027.